I don't know how many of you know me. I am not a medical doctor. I am a doctor-nurse, PhD in nursing. For 41 years, I administered anesthesia for surgical, diagnostic, and obstetrical procedures. The last 5 years, I've worked with Terry Shintani here locally on island with his 10-day reverse disease programs. And I do the physical assessments, the follow-up with each individual client, each and every meeting, and regulate the medication dosage for the diabetics and hypertensives. How I share information is today, this is the first talk that I've given to a group in 20 years, and we're the first people to listen to this presentation, so consider yourself fortunate. I look at information sharing in relationship to number one is the Bible, number two is inspiration, and the third basically is that of evidence-based research. I believe that the Creator basically intended for all of us to be in good health so that we might serve Him. Healthcare providers do have some truths that they can share to enhance and cure certain individuals if they'll follow and adhere to them. I also believe that God has a plan. God's plan is not man's plan. God also has the availability in His health providing that He's an equal opportunity God in as much as everyone should be able to afford basic health care. What is truth? Truth basically is not what I believe. Truth is a fact. I may not believe it. I may not know it. That doesn't change it. It is therefore nevertheless waiting to be discovered and believed. Truth does not depend on unsettled and changing opinions of men. It was truth before we believed it. It will remain truth whether we believe it or not. Definition of disease. Many individuals have their own definition of disease. I like this one from Happiness and Health, or to Health and Happiness, where disease is an effort of nature to free the system from conditions that result from a violation of the laws of health. Presentation content this morning, or I should say this afternoon, we're going to talk very, very briefly about lifestyle diseases, working definition of diabetes, warning signs and risk, insulin, management, medication, diet, exercise, long-term damage caused by diabetes, prevention, recommended daily allowance for protein, water, and calories, and then followed with meal planning, which is going to encompass planning one's day, serving sizes, and a 3-week example. These are just some of the diseases and conditions that man gets from lifestyle choices. Metabolic syndrome. Does anybody in the group, can they define what a metabolic syndrome actually is? It has 4 components. In brief, overweight. When you think of overweight, I look at the universal standard, and that's to measure a man at the umbilicus or a woman at the umbilicus. When a man is 40 inches or more around, or a woman is 35 inches or more around, they're obese. I'm sorry, that's from the World Health Organization. The second factor deals with cholesterol, triglycerides, elevated. It depends on who you read, whether it's 150 or 250 and above. The third category is blood pressure, and basically what you look at is we've settled on the numbers above 140 or above systolic and 90 or above on the diastolic numbers. And then, of course, a fasting blood sugar greater than 110. Diabetes is not picky. It can basically occur at any age. It has early signs and symptoms, which most people tend to overestimate or overlook. And 1 in 3 people is undiagnosed in the United States alone. That these individuals are unaware that they actually have this condition. What does diabetes actually do? It interferes with the body's ability to metabolize carbohydrates for energy, leading to high levels of blood sugar. These chronically high levels increase a person's risk for nerve damage, vision loss, cardiovascular disease, and other conditions such as kidney disease. few of the signs that most people experience up front, and they go to their physician and start complaining of the symptoms, saying, what is wrong with me? And the physician basically looks at them, and one of them is the three polys: polydipsia, polyphasia, and polyuria. All this means is excess thirst, excess hunger, and excess urination. Other symptoms that basically deal with the polys is dry mouth and weight gain or loss. A few additional warning signs of elevated blood sugar is persistent fatigue, just chronically tired, blurred vision, and headaches. More warning signs are infections or sores that do not heal, and in women, frequent yeast infections, urinary tract infections, and itchy skin. One of the other common problems that bring most people to the physician for the first time is known as dysfunction. There's no children here, so we can say the word is impotence. 35 to 70 men that have diabetes will eventually come down with impotence to some degree, and approximately 1 in 3 women. The rest can be prevented with their lifestyle choices. Some of these include cigarette smoking, being overweight or obese, especially around the waist, which we talked about earlier, lack of exercise or a slothful personality, consuming a diet high in processed meat, fat, sweets, and red meats, elevated cholesterol, especially triglycerides, and loss or decrease in your good cholesterol. Think of cholesterol in 3 forms. Number 1, the good cholesterol is HDL. The lousy or the bad cholesterol is LDL. And then, of course, the combination of the worst is the triglycerides. Women also have certain risk factors in addition, unfortunately. One of them is women tend to be more towards becoming diabetic when they basically have gestational diabetes during pregnancy. Another sign that is very predictive is women that have babies that are 9+ pounds at birth. And the third is individuals that have polycystic ovarian syndrome. How does actual insulin work so that we have some kind of a concept of what's going on within us? Insulin basically is a hormone. The hormone basically is released by the beta cells in the islands of Langerhans from the pancreas. What does it actually do? Carbohydrates start to be broken down in the mouth and in the stomach into sugars. From there, the glucose enters into the circulation. It goes from the stomach into the small intestine and is absorbed into the bloodstream. Insulin then basically is stimulated from the beta cells. From this point, what happens is insulin connects with the glucose and basically takes it by the hand and goes to the individual cells. Each cell has what is known as receptor sites. It takes the sugar by the hand, brings it through the receptor site into the cell so the cell can use it either for stored energy or for current energy at the moment. Then there's a condition that's very prominent of late called insulin resistance. And in the past, it was always believed that insulin resistance was a condition that occurs when the body has so much glucose circulating in the bloodstream, the cells are jam-packed to the point that they can't accept anymore because they're full. Well, then they see that for some reason, what does the body do? The pancreas, the beta cells start releasing less insulin and less insulin because they soon realize they can't take care of the condition. Unfortunately, a new discovery, I should say fortunately, a new discovery was discovered in Europe of this last year, and it was like, sugar doesn't cause diabetes, insulin resistance, fat does. And this is what we think. When you eat a high-fat diet, what happens is the fat is circulating in the bloodstream. It basically blocks the receptor sites. Think of the doors as the vehicles into the individual cells. When fat blocks the receptor sites or the doorways, insulin cannot take the glucose by the hand and lead them into the cell. Therefore, they stay within the bloodstream. Therefore, what the body does is they have all this insulin circulating in the bloodstream for long periods of time. Unfortunately, what happens is the pancreas says, well, they don't need me, they have more than they need, so I'm just going to produce less, and it starts producing less over time. How is diabetes diagnosed? In the past, everything used to be a fasting blood sugar, and there were numbers. Anybody that's over 120 basically was considered diabetic on a fasting blood sugar. Individuals became very clever in how they basically followed their physicians, and what they would do is this. Today is Sabbath, today is Saturday. I'm going in for a blood test to see my physician on Monday. Therefore, I ate everything I wanted for weeks. My blood sugar was up. Now I want my blood sugar down because I don't want to be scolded by my physician. So what they did is, starting on Sabbath, cut out all sugar, basically took their diabetic medication, maybe increased their exercise just a little bit, and jammed up on high-dose cinnamon pills to get the blood sugar down. So when they went in on Monday morning, the blood sugar was within a normal range. The doctor gave them a compliment, told them to keep doing what they were doing, and he was happy. Except, all of a sudden, they start to develop complications from diabetes. And he's saying, I'm not sure what happened. So, the new test that came along, and most diabetics are familiar with it, it's known as Hemoglobin A1c. This test doesn't measure on-the-spot glucose in the bloodstream at the current time. What it does is it looks for the glycosylated hemoglobin that is bound to glucose that is measured in the body over the past 2 to 3 months.
Smart.
See the difference?
Smart.
Can't fool the hemoglobin A1c.
Yeah.
Therefore, he now looks at the percentage of the numbers, which are a little different, and we'll talk about that in a few minutes. Here we go. Hemoglobin A1c. To look at a normal individual's hemoglobin A1c is below 5.7. Pre-diabetes is 5.7 to 6.4. Think diabetes at 6.5 to 7.5, and you think of an oral hypoglycemic, or to start individuals on metformin. If your hemoglobin A1c is 7.6 or higher, skip the oral hypoglycemics, start the individual on insulin injectable. When we talk about management, it's best for individuals, especially diabetics. If you're a diabetic, you need to go in for your routine checks and make sure that you're being monitored so that your physician can also monitor you for comorbid conditions. Individuals that are pre-diabetic or diabetic and don't know it because they haven't been diagnosed yet need to go in for regular checkups, especially if you're prone or have a family history, so that you can be caught early to prevent long-term complications. What is one of the things that no diabetic wants to hear? The word is exercise. I cannot stress this one word enough. Fortunate, unfortunate. I just came back from Wiemeyer. Wiemeyer philosophy, the way they teach in their WellStar program, especially for their diabetics, is very comparable to what we teach here locally with Dr. Shintani and Dr. McDougall. Exercise. Diabetics should wean up. When I say wean up, it's like don't basically kill yourself the first day of exercise. You need to wean up to 1 hour a day of walking or 10,000 steps, starting at a gradual pace. Individuals that have a history of sitting on the couch need to wean up slower. In addition, individuals that are not have a history of exercise, when they do exercise, if it's a walk, which is super good, what you need to do is you need to take a piece of fruit with you. Because exercise stimulates insulin. Basically, it's going to bring your blood sugar down, and you can go into a snow dive. You do not want to go hypoglycemic. So, if this should occur, you take a small apple, orange, or pear with you so you have something to eat. Please do not take sugar. Please do not take candy. Please do not take fruit juice, because you will get a spike, which means you're going to be hyper, you're going to be stressful, and what happens with a high glycemic spike? It drops dramatically, and now you snow dive. And so you're now in the yo-yo effect. You don't want to do this. We all know stress increases insulin, also increases blood pressure. Stress with an increase in insulin can bring some individuals into hypoglycemia. So, if you're under a lot of stress, basically try to do some kind of relaxation program that fits your lifestyle. The same with the exercise. I can say walk, I can say swim, I can say golf, I can say anything I want to you. You're only going to do what fits into your regime and your lifestyle. So you need to choose what is for you without using the words, I can't. What is the world's treatment for diabetics in general worldwide? Unfortunately, it's a sick concept. They stress to take a lot of little meals periodically through the day. This you do not need to do. Why? Number one, your digestive system and your body needs a chance to rest during the day. And by taking frequent meals, you constantly have your body churning, secreting gastric juices, intrinsic factor, and working. Try to get away from this, and later in the lecture we're going to talk about meal and meal planning. Second point is take these medications and take them as your doctor prescribes or orders. If the medications are not working for you, fine. We do one of two things. We either increase the dosage or we start you on an additional medication. Medications are not benign. There's not a single medicine on the market that doesn't have some kind of contradictory or side effects. And remember this, once you're started on a medication, your doctor does not have a plan ever to take you off of it. It's like a Band-Aid. So, hopefully we all see the Band-Aid, that medicines do not cure anything. All they do is alleviate and or treat symptoms. When it comes to oral medications, the first one that most people think about is the oral hypoglycemics. These individuals basically are given to control between diet and exercise your blood sugar so that you don't go into diabetic complications from too much blood sugar in the bloodstream. These can come in any combination. We talked about what the universal one is for the world in general to start with, and that is metformin. And any of the oral, injectable medications can be given in any combination. What your doctor is looking for, he's looking at some way to control you, to keep you in check. If oral hypoglycemics do not do the trick, you cannot get your blood sugar within a normal level, you progress to insulin injections. And this happens because your beta cells within your islets of Langerhans are not secreting adequate insulin, even though you've tried to stimulate the cells to secrete with the oral hypoglycemics. You actually need injectable insulin. There's a third medication out that came out within the last 5 to 10 years. These are non-insulin injections, and some of you may be more familiar with them. I personally don't know why somebody would want to take a medicine injectable over oral, but It's okay. So, Pulimatide, Semilin, Evatide, Byetta, Tirzepatide, and Erlictosa. These are current drugs that can be pre-registered with current amounts. You just stick it into your thigh, do your injection, you're done for the day. All right, testing. When you test your blood sugar, you need to check apples with apples and oranges with oranges. And what I mean here is this. Whenever you do your blood sugar between you and your physician, it should be the same time every day. If it's a fasting upon getting up in the morning, it should be the fasting every day. So you're comparing number after day after number after day, so it's all the same. We know that the highest insulin level that sugar level that you're going to have is 2 hours post-eating. So if you're going to do 2 hours post-meals, then it should be 2 hours post-meals. Some people also do them twice a day or 3 times a day, and or some individuals do them an hour of sleep or bedtime. Let's talk about a few of the long-term conditions or problems with diabetes. One of them is the increase in circulation in the bloodstream basically causes a certain amount of plaque. It irritates the intima or the lining of the vessels, which can cause clots. When clots break off, they can do one of two things. You can end up with a heart attack with the heart or a stroke with the brain. Neither are a good situation. Kidneys. We all know somebody who basically is on kidney dialysis. It's just a matter of time. 44% of all individuals that are on kidney dialysis in the United States, it's due to a complication from diabetes. That's almost 1 in 2. That's a very high number. Diabetes also tends to cause vision damage. What I mean by vision damage is the capillaries in the retina, which is the posterior aspect of your eye, which aids in your vision. Basically, forms hemorrhages or the blood vessels break because of the excess sugar within the vessels. This causes blindness. People between the ages of 20 and 74, the bulk of them in today's age in America are due to diabetic complications. Another long-term condition with diabetes is nerve damage. Every one of us knows that individuals with diabetes tend to have sores, ulcers that do not heal due to poor circulation because the sugar basically blocks the vessels, the capillaries within the periphery, and it prevents circulation or blood flow. One of the side effects is numbness and tingling. The numbness and tingling over time goes to pain. Now, anybody that drives a car or is dependent on driving, once you get numbness or tingling in your feet, you need to give up your driver's license because you can't feel whether your foot is on the brake or the accelerator because you can't tell. Okay, we talked about ulcers. The next thing following ulcers is amputations from poor circulation, which leads to gangrene. Okay, we talked briefly about prevention. Prevention basically is lifestyle choices primarily. It has to deal with diet, exercise, and being screened appropriately at sufficient times to pick up early diagnosis and treatment. How many people fell asleep?
None.
I'm up.
Okay, let's see who's awake. We talked about neuropathy. We talked about insulin resistance. Who can tell me what neuropathy means? Anybody?
It has to do with the brain, right? Neural, and then nerves. Neuropathy. Okay.
Big hint.
Neural. Oh. Pins and needles?
Numbness, tingling, pins and needles, hands and feet.
Yeah.
Neuropathy. Got it?
Mm.
Insulin resistance. Everybody know what happens here?
They They fight?
The-
Do they fight with us? The cells fight with the
cells, right?
insulin?
Excellent.
Yeah,
Got it.
right on, right on.
The Bible basically talks about 3 diets. They list 3 diets. The perfect diet was God's original plan, which was the Garden of Eden.
Amen.
Amen.
And what did we eat in the Garden of Eden?
Vegetables.
No. Fruit,
Not
nuts,
and seeds.
grains, and
Seeds, right?
seeds.
Seeds.
Vegetables were introduced once they left the garden.
Chapter 3.
Following the flood, we went into Leviticus 11 and Deuteronomy 14, which gives permissible flesh. And then we also talked about what is prohibited. It basically deals with scavengers, right?
Yes.
So actually, you could eat the biblical way and still live.
Say it again.
You can eat the biblical way without the vegetables and fruits.
No,
I understand.
no. God introduced the vegetables at the time that He introduced them. Well, when they left the Garden of Eden.
Right, right.
So Adam and Eve ate vegetables. Okay, when we talk about meal planning, I put this slide up here twice because this, for anybody that wants to talk about meal planning or to plan meals in advance, you have to learn a few numbers. And whether it's breakfast or lunch, always think of 3 to 5 carbs. 3 to 5 carbs. Protein, 1 to 2. Fats, 2 to 4 for both meals, breakfast and lunch. Your 2 heavy meals are the first 2 meals of the day, 5 hours apart. If you decide to go for a third meal, it's a light meal or a light supper, and it's known as 0 to 3 carbs, 0 to 1 protein,
Skip
and 0 to
supper.
2 fats. Just, you're going to see this slide again. We need to start thinking of these numbers.
Would you prefer someone to skip a meal, like to skip some supper,
Yep, supper.
and just have fully breakfast and lunch?
At Wingmeyer, for all individuals that went through the Well Start program, they offered 2 meals a day. I went on 2 meals a day for 3 weeks when I was there. Same way with all the diabetics and hypertensives.
Wow.
We will get into the foods and the amounts. You're not hungry.
Right, did you mention hypertensive too? So it was both diabetics and people that had high blood pressure.
Went on 2 meals a day.
Got it.
Everybody there was on they were offered 2 meals a day.
Got it.
I would say maybe 1 in 6, maybe 3 people out of 30 opted for 3 meals.
So this meal plan is also good for people with high blood pressure?
Yes.
Yeah.
Got it.
Good. Yeah.
Let's talk real briefly about the following. RDA, all that means is recommended daily allowance of protein, water, and calories. In order to talk about any of these 3, you have to keep in mind the following 3 components. Number 1 is age. Number 2 is gender. And number 3 is physical activity. Now, regardless of which one you pick, instead of memorizing numbers, what I suggest everybody do is this. We live in a computer age. If you know somebody or you have access to a computer, you can find this number for you anywhere, anytime. All you have to do is Google RDA protein, RDA calories, RDA water. It will come up. It will give you a formula. You plug in your numbers and it will give you one specific for you. Let's talk about protein to start with. America is obsessed with protein, unfortunately. One thing is they give 2 examples. Most of us are not familiar with kilograms, so let's just skip kilograms and go to the pounds. Both of these formulas are on Google. You can Google them, you can find them. So, say you're 150 pounds, you just take that times the magic number of 0.36. You come up with 54 grams of protein per 24-hour period or per day. So roughly you think 56 grams for a man and 46 grams for a woman. If you want what is specific for you, Google it, type in your age, your gender, your physical activity, and it will give a specific gram number for you. So, briefly, just a rough guide. Babies, basically 10 grams of protein a day. School-age children, 19 to 24. Teenage girls, 46. Teenage boys, 52. Adult women, 46 or 71. Why the huge discrepancy? Women that are pregnant and or lactating, breastfeeding, need 71. An adult man, 56. One more key point. You only need 10% of your daily calories from protein. Once you push 30 to 35%, you're putting yourself prone for two problems. One is fatty liver, and the second is kidney failure. Let's talk about the RDA quickly for water, and I think I'm losing a couple of you. So let's just do these quickly. Men, basically 13 glasses a day. Women, roughly 9 glasses a day. The old standby that most of us used was 8 times 8. In other words, 8 glasses of water times 8 glasses in a 24-hour period. I strongly suggest you start with your fluid intake upon awakening in the morning. I try not to drink any fluids after 6 p.m. because I don't want to be up all night using the restroom. 2 easy guides to see if you're adequately hydrated or dehydrated. We can all do these ourselves. We don't need any help. The first one is, when you urinate, what color is it? If it's clear, you're adequately hydrated. We're all sitting in a sitting position. Each one of you, what I want you to do is I want you to take 2 fingers, push down on your shin, and let go. And what happens?
Push down your shin.
If you have an indentation, which is a concave dimpling, you have edema, which means you have extra toxins and extra fluid that you're carrying around in your extremities.
Wow.
It collects closest to gravity. Your feet is closest to gravity, the floor, right? So what does that mean? It's telling you need to do 2 things. One, you need to exercise to get that fluid, those toxins, from your lower extremities to your core, your own poop. From there, you need to increase your fluid intake. That's water intake to flush it through the kidneys.
Right, how do you check that? What do you say? Press 2 fingers
2 fingers
on the shin?
on the shin.
So how much of an indentation do you see if you have this problem?
LA, whatever, you can see. Some people.
It'll go in.
Any time of day or night.
No, he said how much? Any small dent, if there's a dent. Because normally you shouldn't have a dent.